Welcome to Hizentra and Me, a CIDP success story featuring Elizabeth Thirtyacre. Elizabeth Thirtyacre is a nurse and a CIDP voice-to-voice patient advocate and is here today to talk to you about her experience living with and treating CIDP.
I hope through my sharing of my story, you feel less alone and more capable of talking with your provider to deal with CIDP and use whatever medication that you guys decide together works for you. So I was about 25 when I first started to have symptoms. I had a lot of weakness and fatigue. I was working a full-time job and going to school full-time. And I live in Columbus, Ohio. Around wintertime, I had an excuse for every symptom that I had. I was falling a lot. It was icy and snowy out. I was fatigued. I was working full-time and going to school. So I waited quite a while before I sought medical attention. My primary care provider did do an assessment once I reached out, and that assessment showed neurological deficits. So she referred me to a neurologist. The neurologist was a little bit hard to get into, about 2 to 3 months, because they're pretty busy people. So after I got in, I was already kind of on an upswing of symptoms. And the neurologist said that he thought I had Guillain-Barré syndrome, and there was no treatment plan at that point because of how long it took to get to them and to get to a diagnosis. So I left kind of deflated and felt like, it's amazing that you can stop yourself from getting treatment because of your own stubbornness. About a year later, I had more symptoms, a lot more fatigue again, and weakness. I had problems carrying a basket of clothes up the stairs and things like that. So I reached back out to the neurologist. At that time, we did more testing, and he decided to change my diagnosis to CIDP. With that came treatment options. So after a couple months of being on it, we would try to wean, and I would get to about the 4 to 5 week mark, and I would start to have some weakness and fatigue again. So at that point, I was able to switch neurologists because of job changes. And my new neurologist had patients that had been on IVIG for a while, up to 20 years plus. So she didn't see any issues with me continuing that treatment since it was working for me. We found a regimen that worked for me. I got treatments about every 3 to 4 weeks. And then I started to have IV access issues. So the infusion nurse were talking about talking to my neurologist to have port placement. As a nurse at this time, that just red flagged infection for me, and I really wasn't all about getting something implanted in my body. I was able to speak with my neurologist, and we went through all the different treatment options. One of those treatment options was a trial of a sub-Q therapy, and I was already working in home care at that time. So I felt like I would be comfortable with doing that to myself, and the benefit of being able to do my own treatment in my own time frame, on my own schedule, in my own home was a benefit that I was willing to risk trying it out for. So I have been on sub-Q therapy since 2015. It did work out for me.
Hizentra, immune globulin subcutaneous human 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Warning: blood clots can occur with immune globulin products, including Hizentra. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation of this warning. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. Please see full prescribing information for Hizentra.
I've had some site reactions of redness and some itchiness. I found that I was taking the tegaderm off wrong. So if you have any questions, it's very important to be in contact with your home care nurse and your specialty pharmacy to make sure you're using the correct size needle and all of that. I found that using a deeper needle makes it so it's less itchy, of course. So I'm really getting into that fat tissue. I'm not the best patient. I like to use my stomach a lot. I feel like that's what my spare tire is for. So that's where I put most of my infusions, but I have branched out to my thighs as well. And I really feel like even with the minor side effects of site reactions and things, it's a treatment that works best for me. I'm able to travel with it and everything.
Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease CJD agent and its variant VCJD cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching, and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. See full prescribing information, including boxed warning, as well as important safety information at the end of this video or at Hizentra.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.
So CSL offers a voice-to-voice program, which is where patients like myself speak at programs like this. And then there is also a call-in line available if you would like to talk to a patient like myself or myself, depending on your age range and all of that. They match you up with somebody that you can speak with about CIDP and their transition from IVIG to sub-Q treatment. Of course, they're not going to be able to answer any medical questions, but they can speak to their experiences and what they have found helpful. And that information can be found at Hizentra.com if you're interested.
If you have CIDP and are interested in the convenience of self-infusing your treatment on a schedule built around your lifestyle, talk to your doctor about Hizentra today. And remember, you can always talk to others with CIDP and hear their stories for support through the CSL Behring Voice2Voice program. Just call 1-877-355-4447 to connect with someone or sign up at Hizentra.com. Important safety information. Hizentra, immune globulin subcutaneous human, 20% liquid, is a prescription medicine used to treat primary immune deficiency in patients 2 years and older, as well as chronic inflammatory demyelinating polyneuropathy in adults. Warning: thrombosis, blood clots, can occur with immune globulin products, including Hizentra. Risk factors can include advanced age, prolonged immobilization, a history of blood clotting or hyperviscosity, blood thickness, use of estrogens, installed vascular catheters, and cardiovascular risk factors. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Treatment with Hizentra might not be possible if your doctor determines you have hyperprolinemia, too much proline in the blood, or are IgA deficient with antibodies to IgA and a history of hypersensitivity. Tell your doctor if you have previously had a severe allergic reaction, including anaphylaxis, to the administration of human immune globulin. Tell your doctor right away, or go to the emergency room if you have hives, trouble breathing, wheezing, dizziness, or fainting. These could be signs of a bad allergic reaction. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. Inform your physician if you are pregnant or nursing, or plan to become pregnant. Infuse Hizentra under your skin only. Do not inject into a blood vessel. Self-administer Hizentra only after having been taught to do so by your doctor or other healthcare professional and having received dosing instructions for treating your condition. Immediately report to your physician any of the following symptoms, which could be signs of serious adverse reactions to Hizentra: reduced urination, sudden weight gain, or swelling in your legs, possible signs of a kidney problem, pain and/or swelling or discoloration of an arm or leg, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, unexplained rapid pulse, or numbness or weakness on one side of the body, possible signs of a blood clot, bad headache with nausea, vomiting, stiff neck, fever, and sensitivity to light, possible signs of meningitis, brown or red urine, rapid heart rate, yellowing of the skin or eyes, chest pains or breathing trouble, fever over 100 degrees Fahrenheit, possible symptoms of other conditions that require prompt treatment. Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, and its variant, VCJD, cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. Before receiving any vaccine, tell immunizing physician if you have had recent therapy with Hizentra, as effectiveness of the vaccine could be compromised. Please see full prescribing information for Hizentra, including boxed warning and the patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.